It goes on to say in page 426 and 427, and I want to read this line here. The identification of resources that an individual may use to determine the requirements of the state in which such individual resides, so that, this is important, the treatment wishes of the individual will be carried out if the individual is unable to communicate those wishes. I got to read that again. So that the treatment wishes of the individual will be carried out if the individual is unable to communicate those wishes. You can read this for yourself. The information is right online. You can read this for yourself. I urge you to read it for yourself. Don't take my words. Read it for yourself. So, what does that mean? That means that we're talking and we're communicating with our doctor. It's a part of an empowerment process, not a process in which you give power over to the doctor, so the doctor is crystal clear. The worst thing that you would want to have happen to you is that you don't talk to your doctor, and in the process of not communicating your wishes to your doctor, you know what, whether you are 25 years old or 75 years old, you should have a living will, period, and a healthcare proxy, period. So that if you are in a vegetative state or in a coma and you're 25 or 75 and you're not able to communicate your wishes, if you've had that conversation with your doctor, the doctor knows exactly how to treat you as a patient, and he'll just follow the wishes that you've outlined in your well state of mind. This is quite frankly extremely disturbing that it's been put out there like this. You want to talk about real death panels though? Let's talk about real death panels. Let's talk about out in California where Pacificare just denied 39.6 of all of their claims filed for the first half of 2009. Let's talk about Cigna that denied 33% of all of their claims for the first half of 2009. Okay? That's a real, it's called a death panel. They're denying claims. Anthem Blue Cross out in California, the state's largest for-profit healthcare plan, and Kaiser, the state's largest not-for-profit plan, each rejected 28% of claims. That's called a death panel. They are denying you your right to get coverage. It would not happen if you had a public option. But since you're in the private industry, they're denying your claim. Let's look at, you ever heard of Kim Kutcher? Kim Kutcher of Dana Point, California. She was scheduled to have back surgery. She and Blue Cross Blue Shield denied her authorization for the procedure because they said it was investigational, even though the lumbar artificial disc was approved by the FDA. That's called a death panel, deciding who they wanted to have procedures to. Let's talk about Bob Scott, who's 57 years old. Bob Scott was in diagnosis of a brain tumor in 2005. What happened with Kaiser Permanente? They said, we're not going to give you coverage. Because they said his age, he was too old in order to get coverage. That sounds like a death panel to me. Tragically, his wife said he's been in perfect health all of his life. The only thing he ever had was a sprained ankle. He was denied coverage. Tragically, Bob Scott passed away. Let's talk about Natalie Sarkisian of Northridge, California. You know, at the end of the day, she wanted a 17-year-old. She was 17 years old. She needed a liver transplant. She was denied at first from Cigna. Cigna said, no, we're not going to give you a liver transplant. At first, they waited, they fought it. Finally, they changed their mind, but at that point, it's too late. Natalie eventually passed away. That's called a death panel. That's called a decision making. These things are going on right now. This wouldn't happen if we had a public option. And, forget about those 47 million, or, people say 47 million, and then the people on CNBC and Fox, they try to whittle the numbers down to 5 and 10 million who actually need coverage, or whatever numbers. Forget about those people for a second. The people who do have coverage need assistance. The people who do have 30% of all of those individuals earning between $30,000 and $75,000 a year are in jeopardy of losing their coverage because they can't afford it. These costs are going rampant, and those who do have coverage are in jeopardy, and especially those who don't have coverage are in jeopardy. There needs to be a change. We are the only country, the only industrialized country in the world where human lives are sacrificed for the sake of company profit. Let's talk about healthcare costs. How much would this plan cost? The first myth, they'll talk, and then when you hear it on television, it costs $1 trillion. You know what? It may cost $1 trillion, but it's over 10 years. It's not over in 1 year. They make it seem like it's 1 year, but it's over 10 years. That's about $100 billion a year. Okay? Not all of this is deficit spending, meaning that it's not going to add to the deficit. It'll only increase the deficit by around maybe $200 billion, again, spread out over 10 years. Okay? But again, let me remind you what Barack Obama has always stated from the beginning. He is not going to sign any piece of legislation that adds to the deficit or that is not budget neutral. Okay? It's going to be paid for. Unlike the Bush tax cuts, which were not paid for, unlike the Medicare prescription plan, which was not paid for, that we paid an additional $700 billion. Those weren't paid for, but that seemed perfectly fine to do under the Republican administration. Okay? Now, in the figure of cost savings, the Congressional Budget Office, a totally unpartisan organization, the increased budget deficit will be about $65 billion total when you include the cost savings that this plan is going to do. So that means that we're going to add about $6.5 billion a year. Well, guess what? Where I want to get that money from? Let's repeal the George Bush tax cuts that, at the end of the day, were given to us in a time of war. And it was he was the first president in the history of this country to ever decrease taxes during a time of war. We did not need those tax cuts. We could not pay for those tax cuts, and those tax cuts should be repealed. Okay? You repeal the tax cuts, you can help pay for this health care plan. So now, is there a health care crisis? You ask Rush Limbaugh, who says that there's no health care crisis, or ask Steve Ducey, who says currently 90% of all Americans have some sort of health care coverage, which means they're effectively blowing up the system for 5%. Now that 5%, you got to worry about them. You got to worry about everybody who doesn't have it, but is it worth it all for 5%? Acting like there is no health care crisis. In reality, 25 million Americans are underinsured, according to Kathy Schoen, the Senior Vice President of the Commonwealth Fund. From 2003 to 2007, those who were insured all year but were underinsured increased by 60%. So there's a problem with those who have insurance but don't have enough insurance. The underinsured, she goes on to say, does not receive adequate health care or when they face financial hardship. Over half of all the underinsured and 2/3 of the uninsured went without recommended treatment. Okay, that means that you have insurance and you're included in that, according to Steve Ducey's figures, 90% of all health care. In that 90%, the amount of underinsured increased 60%, and a half of them didn't receive recommended treatment. Who's paying for them when they go into the emergency bill? We are. We're paying on average an extra $1,000 because we're paying for somebody else's health care. We need reform. It goes on to say, let's talk real quickly about health care reform for undocumented immigrants. That's a big talking point. We've heard Dick Morris say, well, you can't have the surgery because we're going to give immigrants your health care coverage. We've heard that. That's a common lie or a blatant mistruth or whatever you want to call it. He might just be ignorant about what's actually in the bill. Let's talk about what's in the bill. Section 242 of America's Affordable Health Care Act of 2009. Definition. For the purposes of this division, the term affordable, credible, eligible individual means, subject to subsection, an individual, listen, who is lawfully present in the state of the United States. In a state in the United States. Again, let me read that again. An individual who is lawfully present in a state in the United States. That means that if you're an illegal immigrant, this does not cover you. Okay? We have to understand that. There is no federal payment. Let's talk about the Senate help bill. That's over in the House. Let's talk about the Senate bill. There's no, in Section H, no federal funding. Nothing in this act allows federal payments for individuals who are not lawfully present in the United States. Illegal immigrants do not get coverage. That is a lie. That is a mistruth. Let's talk about how health care reform is going to raise your taxes. Real quick on this one, the surtax in the House bill applies only to the income exceeding $350,000 per year for joint filers.